Hello and welcome to this video masterclass, a practical guide to HIV testing. My name's Jack Shaw, I'm a GU and HIV consultant, and I'll be presenting this video along with my consultant colleague, Dr. Davies. We both work in the sexual health service in Exeter, where you may meet us on a clinical placement, but also Sophia provides the local teaching at the medical school for HIV. We're hoping to build on that teaching and also the other HIV masterclass video founded by our colleague Francis Keane, Cornwall, which introduced certain aspects of HIV, especially the virology, treatment, and also clear information about an HIV test and what it entails. We do believe, though, that actually the most important aspect of HIV for yourself as a student and a future junior doctor is to take that knowledge forward to feel confident offering people tests. Because offering tests and making diagnoses is where you can make a difference for HIV wherever you work in a clinical environment. So through this video, we're hoping that you'll gain more confidence in a testing offer through discussion of things such as individual and wider benefits of testing, so for the patient and the public health. We're going to talk about barriers to testing, and we know that that is an issue in clinical practice, and also a practical approach to how you can actually offer tests to patient, including especially the language of testing. We're going to talk about the management of a positive result, which can be intimidating for anyone to manage, and also the importance of the U=U statement, which Frances mentions in her video, we felt was very important to highlight during this presentation. So hopefully, as we say, we'll reach the end and you'll feel more confident in understanding the testing offer for HIV.
So if we have a think about the benefits of testing, we can divide it like this into benefits for the individual and benefits to wider society. And it's easy to focus on the health benefits, which are fairly evident. So it's important to recognise that we're preventing illness and we're preventing death. So by HIV testing early, you can be saving lives. As well as that, we're really preventing other people from getting infected. So by testing that individual, they are not going to be able to go out and infect other people. As well as that, it's essential that we recognise that the psychological impact of knowing your status is really profound when you're engaging in the dating scene, for example, and empowering to know what your status is and whether or not you're at risk of infecting other people. For society, when we think about the NHS and wider society, it's well recognised that testing people early is much less expensive in terms of their lifelong treatment than it would be if you diagnosed them late and they required intensive management as an inpatient and potentially intensive care. Additionally, for their impact on social care, their ability to contribute to the workforce and to family life, these things are much enhanced by testing early.
So at this point, we need to think about the practical aspects of offering a test. We need to think about your individual thoughts around offering testing for HIV. So let's take an example. Imagine that I'm sat opposite you at the moment in a sexual health service. I've come for a sexual health screening. You need to offer me an HIV test. Do you feel confident to do so? If not, why not? What if the situation was different? Please add 30 years to my age and we're going to change the location. We're now sat in a GP practice. I've just come in for a routine health check. We're talking about my cholesterol. Do you need to offer me an HIV test now? If not, why not? Have you done a risk assessment for my HIV risk? Do you know anything about my history that makes you feel I should be offered an HIV test? Maybe we could move the location geographically. We're having this conversation in the centre of Manchester, where I trained. HIV is more common here. Should I be offering everybody I see an HIV test? All those internal questions come when you're thinking about testing a patient, and it's important to confront them and see if you can knock down those barriers. So one common one is the unfamiliarity with a test. So actually knowing what the HIV test is, what are we looking for in the blood? And Francis's HIV presentation highlights that. Remember, we're looking for the antigen and the antibody of HIV. There's also misconceptions very widespread, especially in the older clinicians, about the amount of consent that's required for HIV testing. So we need to think that actually back in the 1990s, there was an extensive consent process involved. There was comments about life insurance. All of that has gone. There is still a verbal consent requirement, but that is all. And Sophia will talk to you more about that later in this presentation. Very importantly, you need to think about your own internal bias and also the bias of the patient. And that is influenced by stigma of HIV in the wider community, but also the level of perceived risk that someone has about whether they could be HIV positive. For a clinician, it's important to recognise those. So I changed the situation before. I could change risk factors, my sexuality, my age, my ethnicity. These are all things that may increase the risk of being HIV positive. But flip that on its head. Try and think of a reason why not to offer this patient an HIV test. And I would argue with you that that is very hard to do. Please always consider HIV in the differentials for any patient you meet. But clearly, if they have a identified risk through a risk screen, be more likely to offer the test. Think about it for all patients. Cultural factors are important as well, especially if you're working elsewhere in the country outside of Devon. Huge stigma, especially amongst Black African communities, about even just HIV testing itself. And it's important to overcome those barriers. Just see the patient as an individual and offer them a test. If there's a resistance to accepting the testing offer, please discuss that with them. Why don't you want to test? Can we try and normalise this for you? Think about the language you'll use, which we'll come back to. There's also a fear of embarrassment. Talking about sex, people are often embarrassed. We always try and counter that. We're very experienced in doing it in our service. The embarrassment can be you as a clinician, but also as the patient. We'll talk about that language as we go forward. Please try and overcome that fear if you can and offer the test. Think also about the setting. And importantly, for the offer of any test, give it enough time, explain to the patient what you're doing, but especially if you're taking a risk history for HIV testing, think about that being in a confidential environment. And that means you're more likely to get an honest answer from the patient to perform your HIV risk screen. Finally, we have seen instances in the past where people are nervous about offering a test because they're worried the result will be positive. It's a human condition to avoid situations where things can be uncomfortable, especially the concern over breaking bad news. Please try and break through that. If HIV is in your differentials and you're worried about it, offer the test, but also think about delivering the result in a supportive environment, which I'll explain as we go further into this. I'm hoping those barriers may be things that you identify in yourself. Through discussing them, you may feel more confident in offering testing now, but it's important to discuss those with colleagues and with patients, mainly thinking about the language that you will use and as an individual to offer a test to somebody.
It's very important that we think about the language that we use when testing for HIV. We want to give you the tools so that you feel like you can have a conversation with a patient without feeling embarrassed and the patient doesn't feel embarrassed or judged. The GMC still does require us to gain verbal consent for HIV testing, but I think this really ought to be much more of a conversation and an educational event. So this gives you an opportunity to correct any misunderstandings about HIV testing, about the process, about treatment for HIV, about their longevity and so forth. And I think if you have a really robust understanding of the concepts, which you will have gained from watching this video and the other lecture, that you can have real confidence in being able to field those questions that a patient might have. These MedFash documents, which are available online as PDFs, have some really useful tips in them about language when discussing HIV testing. In the appendices, they give you some examples of scenarios and phrases that you can use. And I always think it's useful to have some of these stock phrases up your sleeves for using in these types of settings. What you want to do is to ask an open question in a non-judgmental way. So, for example, when I might see a patient who has a skin rash, and I think, could this be a drug reaction? Could it be some kind of infection? I would say to the patient, this type of rash can be caused by a number of different things, infections, including sexual infections. Is there anything that makes you think you might be at risk of a sexual infection? And your response might get you some information that you didn't receive from taking your standard medical history. So, for example, they might offer that they are a gay man. That isn't a standard question in the history, or that they've had sex on an overseas trip, for example. Conversely, if they decline testing, or they say, I don't know what you're talking about, it gives you an opportunity to educate them about the transmission risk of various different conditions. And if they decline testing on the day, you might find that you've actually planted a seed where you can get them to reflect on things that might have happened, and you can still signpost them to other opportunities for testing that they might act on another day.
So let's now think of moving past the test. You've received a positive result. How am I going to manage this? Your first thing to do is to go back to the patient's history. Is there a clear identification of an HIV test being offered? i.e., is this result on the right patient? Are there indicators that HIV should be in the differentials? Because importantly, you should always consider whether a result could be false positive. It's important to discuss that with the lab, as depending on the testing pattern result, sometimes there can be concerns over that. The second reason it could be a false positive is actually, is this blood from the right patient? So you should always confirm an HIV positive result on a separate blood sample from the same patient to ensure that you're delivering the result to the right person. However, after the initial positive, if it's at all a possibility for this patient, we would expect the result to be delivered to them whilst you are awaiting the confirmatory result. Now, that's the important part to think about. How am I going to give this result? What is the setting of how this discussion is going to happen? When is the right time to do it? And which language should I use? Now, if we take a particular example when this often may happen, you're on the own on the ward, it's 5 o'clock on a Friday, the call comes through. Bob in bed 23 is positive. What do you want to do? The immediate response is often to think, I need to go into the room and tell Bob now about this result. With what you know now, would you feel confident to do that? I would hope that the majority of you would think, I don't feel right in this situation to do that. And I would expect that to be the case, and I'd encourage that to be the case. The question is, what can you do to help? The answer is, call for help. Call to speak to your local HIV consultant or specialist nurse. There's always an on-call rota available. I can tell you the advice I would give you. Just pause. It's the late day on a Friday. It's unlikely that Bob's going to have sex in his hospital bed over the weekend. We'll arrange to come and see him on Monday, and we'll deliver the result together. Because after the initial confusion, upset, sometimes anger that comes with a positive result, there is often 100 questions. And that is the part of delivering the result I would not expect you to feel comfortable with. We are there to help. And the important thing is to try and give the result in a supportive environment for you and for the patient, making sure that environment is confidential and sufficient time is given to give them time to ask their questions. HIV is about treatment, but a lot of it is about reliable, accurate information, especially around aspects such as transmission, which we'll now move on to talk to with regards to the U equals U statement. Please don't try and manage these situations alone. Ask for help.
U equals U, or undetectable equals untransmittable, refers to a public health campaign that was launched in 2016. This showed that individuals who have effective antiretroviral therapy on board and therefore have undetectable levels of HIV virus in their bodily fluids cannot transmit HIV to their sexual partners. It was based upon a number of seminal studies, including the partner studies, which recruited about 1,500 serodiscordant couples. So a serodiscordant couple has one partner who has HIV and the other who is HIV negative. They followed these couples, and over the course of 100,000 or more acts of unprotected sex, there was not a single linked HIV transmission. This is incredibly powerful science, but unfortunately isn't well known amongst either healthcare professionals or people living with HIV. And spreading this awareness of these findings, I think, is partly going to help us to reduce stigma for people living with HIV. The intention being that hand in hand with other prevention measures such as PrEP, which we're now starting to be able to offer, we may see an end to new HIV infections in our lifetime.
So in summary, we think about this presentation now. We're hoping that through discussing these wider issues with you, you'd now feel more confident in thinking about offering an HIV test, but also the practicalities of how to do that and the language you may use for that discussion, but also thinking sometimes you may have to manage a positive result and remembering to ask for help if that's the case. Also thinking about the wider public health benefits of testing, also the benefits of diagnosis and treatment to reduce the risk of transmission to others for those who are HIV positive. Thank you.